Jim Schibanoff, I'm wondering whether you've seen this to be widely true among providers who've adopted electronic health records, that they've seen these kinds of benefits consistently across the board, or has there been more variation? Are there key factors that determine their relative success?
Well, there's a combination of what's actually occurred. Excuse me. What does the medical evidence show about what electronic health records do to improve care? And then what is the promise? Now, we tend to hear more about the promise of the future than what has actually been proven to be effective. The thing that has been proven to be effective is in the hospital setting, where physicians use the computer to write orders that are legible, cannot be mistaken, the decimal point or the number can't be mistaken, so that medication errors are drastically reduced, and the turnaround time from the time that the order is written until the medication is delivered to the patient is markedly reduced. So that, I think, we're pretty much agreed upon. Everything else is a hope and an expectation that is dependent upon a number of factors that we've already heard. Just putting computers into a broken healthcare system makes it broke, but more faster and broke. What you need to do is to improve the healthcare system as you make it electronic. You can't have one without the other.
I want you to elaborate on that just a little bit for the moment, because although we are intending to and do want to focus in very much on the potential benefits of electronic health records in the system, it's important not to overpromise or present it as a panacea. What do you mean by a broken healthcare system? I think I have some idea, but what do you mean by it? And what are the things that you think electronic health records can't in themselves fix?
The fragmented system with conflicting incentives, the incentive for the hospital to keep the patient in the hospital longer because that's what the financial incentive is, the incentive for the physician to order more tests and do more procedures. I mean, there are many countervailing incentives that need to be aligned, and the fragmentation needs to be brought together. The electronic health record can help that if the underlying processes of care are addressed with different financial incentives and different policies that allow the electronic record to be a catalyst for change, as opposed to just another additive technology. Healthcare is bereft with one new technology after another that's just been layered on and layered on. And none of them have been truly transformative, whereas electronic health records can be transformative if the processes of care improve.